not easy getting old. And there are a myriad of challenges that come along with your health care. Who will take care of you? How will you pay? What advice can you find? Even where will you live? I've been fortunate to work extensively in this space and will continue to care deeply about helping marry easy-to-use technology with the people that need it most. We're facing a time of unprecedented need for new services, facilities, and technologies, and global companies and the government alike are looking for the best solutions to cope with and support our growing population. Well, let's turn to our panel to discuss these very impactful topics. Our moderator is journalist Eric Taub. Eric has been writing about the intersection of technology and society, including consumer health technologies, for over 20 years. For the past 18 years, he has been a regular contributor to the New York Times and was one of the founding writers for the Times Circuit's technology section. If there's one thing Eric can do, he can boil things down, very complex topics, into informative, even entertaining language so that the average layperson can understand it. And it's clear from his writing over the years that Eric has a real personal interest in where digital health is going. With that, I'll turn it over to Eric.
Thank you. I became interested in this topic, I think, when I was when I was about 8 years old, because at that time, my mother used to say to my brother and I, whatever you do, don't send me to a nursing home. And I didn't even know what she was talking about. I thought it was a place where nurses lived. And as we got older and she got older, she started saying, whatever you do, don't send me to assisted living. Kill me first. Well, we didn't kill her, and we unfortunately had to send her to assisted living when she was 98. And she lived to almost 101. And she really wanted to stay in her home. She was perfectly capable, except for physical problems. And so we at first thought, well, what we could do is have somebody come in and stay 24 hours. And we had multiple people come in, but that wasn't really a solution because they would quit. Every 4 weeks we had to find somebody else, and she complained that the people in the home wouldn't talk to her. They were watching TV, ignoring her on their cell phone, and so on. So we thought the best solution would be assisted living, and she was in a really nice place, and I have nothing negative to say about where she was. They did their best, the people were wonderful, but it wasn't the same. If you've ever been to one, you know it's a very different milieu than being in your own home. And my mother, when she was 99, took me aside once and whispered, Eric, the people here are so decrepit. And we all want to be in our own communities. And we want to find ways to do that so we can be with people of all ages. So our panelists today are looking at how we do that, solutions to keep people active and remaining in their community so that they don't have to go to perhaps a place that isn't the best place for them mentally and physically, perhaps. And also grappling with what do you do, how do you communicate with people to let them know about your medical conditions and how you're doing in life. So that's what we're going to hear about today from our panelists. We're going to start with Kian Saneii, who is the CEO of Independa. And Kian, you've developed a number of products that are on and about to be in the marketplace that deal with some of these issues, haven't you?
That's correct.
Yeah. Well, why don't you tell us about them?
Well, we have a platform that allows you to plug in a number of solutions. Our view is, as you get older, there we go, thank you. So we have a platform that allows you to leverage a number of solutions. Particularly in geriatric care, it's not good enough just to manage social engagement or just to provide reminders or just to have a medical view of their biotelemetry. You also want to have an activity view, environmental view, social engagement, as well as cognitive skills. So the platform that we have enables that by integrating to various devices and allowing family caregivers, formal and informal caregivers, home care professionals to get exception-based alerts when something isn't quite right.
And how is that information transmitted to the various parties?
Well, inside the home, there's multiple protocols without getting into too much detail, but you want to be flexible as a platform to accept various types of input. We also integrate directly with devices like the TelCare unit. That is a glucometer that's cellular-based, goes directly into their cloud and comes to our cloud. We also, when available, with the LifeComm unit here is a best-of-breed mobile PERS device. So there's a lot of options on how you get this information. We're an aggregator, and we also provide the exceptions based on a wide range of services, including including home alarm system sensors, which are very inexpensive, things like motion, getting out of bed late, leaving the front door open too long, causing a flood, et cetera, et cetera.
So with your product, are you able to program it so that you can have sort of exceptions that if you get out of bed at this time and don't get back in for a certain number of minutes or hours, then an alert is sent?
Exactly. So the trick is to be able to collect all this information and then be able to give simple as well as more and more sophisticated thresholds. So a simple threshold may be if bathroom visits double maybe versus average, then let me know maybe that's an orange alert or a red alert. But a more complicated alert might be if the front door is left open for greater than 30 minutes, let me know if it's during the day, but if it's open at all between, let's say, 10 p.m. and 8 a.m., then let me know right away. So there's a lot of complexity that you can manage very simply through an easy user interface. That's the other thing, is integration is key, but also simplicity. It has to be simple. From a care recipient standpoint, they should do nothing but just enjoy their life. They don't have to lift a finger, learn how to use a computer, none of that.
And are you in the marketplace now?
We're in the marketplace now. We just made a major announcement with LG a couple days ago. So we'll be running on LG commercial TVs in long-term care and senior care facilities. So we were bringing this into the facility as well, but also in the homes.
Could you explain that about the connection with LG? What do you mean they'll be running on your televisions?
Well, think of the hospitality market with LG and LodgeNet. So when you go to a hotel, you have LodgeNet running on LG TVs. That's running on a platform called Procentric, and we're running on the same platform with LG and us going after long-term care market, where you're using your TV, which is on pretty much all the time, and you're comfortable with that device, but suddenly your medication reminder comes up on top of the programming. So while you're watching Murder, She Wrote, you can actually see your medication reminder come up. You can dispose it, and if you don't dispose it properly, then someone would get that exception.
So are you going to do that in the home as well, where somebody can connect to their own television?
So as I mentioned, in the home, the Angela platform that we have, which is for social engagement, runs on tablets as well as touchscreen computers. So we're taking the same software and running on TVs.
And by the way, you mentioned tablets. Is this your own tablet, or is it a...
No, we're purely a software company, so we pick best of breed in the case of a tablet as well as a computer. Best of breed also market leadership with LG. And again, best of breed, and as Rich is going to talk next, in terms of medical, health, as well as activity devices.
Okay, so but it doesn't run on like an iPad.
No,
It's not just a software app or something.
That's correct. You can actually you can run it as an iPad, but our view is you want to have a dedicated system, because if someone can use an iPad and they can switch apps and do iTunes updates and so forth, they probably don't need the social engagement through us. They probably do fine directly through an iPad.
Okay, fine. Good, thanks. And Richard Lobovsky, you're the Vice President of Business Development for LifeComm, excuse me.
Yes.
And you've got a product that's not yet on the marketplace, don't you?
Correct. We are developing a mobile personal emergency response system. We'll be launching that product in the marketplace in the second quarter of this year. We are a joint venture between Hughes Telematics, Qualcomm, and American Medical Alert Corp. For those who aren't familiar with AMAC, they're a traditional PERS provider. So they're a very valuable partner. All three of our partners are valuable partners, but they bring a lot of experience in the marketplace, having delivered emergency assistance services to senior population for the last 30 years. The device is developed in a number of different form factors, a pendant, a belt clip, a watch form, and it does a number of different things. I mean, the base case is really to enable an individual to summons emergency assistance by pushing the button. But it also has a fall detection capability, so we have a number of sensors and software in the device that will enable the system to detect a fall, and if that happens, it opens up a voice and data channel to the back office, which would then enable an emergency response specialist to deal with that particular situation.
And have you tested how many false positives there are, for example, in the fall response?
Absolutely. We are working very diligently to obviously maximize our effectiveness and accuracy. We're still fine-tuning our algorithms there, but we're looking at our goal is a 95% accuracy rate, which is fairly common across other organizations that have devices with fall detection capabilities.
And this works whether you're in or outside the home.
Correct.
And how does it work outside the home to communicate?
Correct. So it's got a cellular modem in it. We use the Qualcomm Internet of Everything module. We're starting off on a CDMA version of that. We will then port and migrate over to a GSM version. But essentially, You know, it uses the cellular network, one of the largest cellular networks here in the U.S. So that's how data is transmitted.
Well, I think the obvious question, because I've also heard people ask this question, is what happens when you're in an area where you don't have a cell signal?
Right. Well, we all know that wireless technology is an imperfect technology, right? It doesn't. There are times where phone calls get dropped, and there are gaps in coverage. So that is a challenge. We do continue to capture information and data when the device is out of coverage, and then when it comes back into coverage, it's sort of a store and forward type of mechanism. So it would then update that information, transmit that call, et cetera.
But you're not going to run with multiple cellular networks in the device.
No, that's sort of impractical. If most cellular devices are geared towards a particular network, and so we may have two different versions running on two different networks, but each version will run on a distinct network.
Okay. And were you going to show presentation?
We do have some slides up there. I don't
know if that does anything. It might be like the lights.
So I'll just
there you go.
I'll flick over to here. So this is an image, a picture of the three different devices. You can see there's a display on the device that actually acts as the emergency button. And obviously, being a cellular device, it supports two-way voice and two-way data. So we can, through a data channel, we can capture things like lat-long position, battery power, and the specific MEID of the device. And then when a call is transmitted, that information goes up first, and then the voice call gets enacted. So when the emergency response specialist answers that call, a screen pop comes up and gives that emergency specialist a sort of a profile of the individual based on the information we captured during the onboarding process.
And there are a number of companies that have similar products. I think we've seen them, we can see them on the floor. How would you say that your product is better and different?
Well, I think first thing is that we're backed by the likes of Hughes Telematics and Qualcomm, so we've got a lot of engineering expertise that we've built into this solution here. Fall detection and activity monitoring are not necessarily unique per se, but right. I believe that our fall detection algorithm is going to be superior to what's on the marketplace today. And I think that one thing that we get constantly as people come and see our devices at our booth is that they talk about the design of the device and the uniqueness of the design of the device. I think one of the challenges in the PERS industry is that people don't want to wear devices that make them look old, that make them look sick. And so we really put a lot of energy and effort into creating a unique design that could appeal more broadly and not necessarily say, I need something to track me, for example. Yeah, I'm sure there would be a lot of resistance to something that was perceived to be that kind of device. Correct. Yeah. So, and fall detection is important, isn't it? Because isn't that one of the main reasons why people have to go into assisted living? Absolutely. So if you look at, we did a bunch of market research, primary market research, and we found that the mobility aspect and the ability to detect a fall were the two highest sort of value propositions that the consumers and the caregivers that we met with valued. Today, there are 36 or 37 million people that are 65 and older, and 1/3 of those individuals fall every year. So there's about 13 million falls a year. As that population grows to 70 to 72 million in 2030, the number of falls will also grow proportionally. So we're looking at practically doubling those numbers of falls. And we all know that falls lead to hospitalizations, leads to healthcare costs. So we believe that we can help to mitigate that. Okay, great. And of course, when people do fall or where they become ill, we as both providers and family members and extended family members want to know how people are doing. And right now, that may mean mass emails or people making telephone calls. But I think Sona Mehring believes she has a better way, a better idea to help people communicate about their loved ones who may be ill. Why don't you tell us what you're doing?
Well, thanks, Eric. I do have some slides to show. I think we've heard a theme over the last day and a half around social. And CaringBridge has been around actually for 15 years doing this social connection during a health event, during a health crisis. We talk about our mission, which is to amplify love, hope, and compassion in the world, making each health journey easier. And I think we all know innately that if your emotional health and you are connected to your loved ones, you are healthier. Your life is fuller. your blood pressure goes down. So this isn't a device. This is the idea of social is a key aspect to your health. And we have found that this it becomes more true in this aging in the home and being able to stay connected when you become a little bit more isolated. We're a nonprofit that I think is fairly unique in this room. We do not have venture capital funding. We have been around for 15 years, kind of pioneered the idea of social networking and always kept it very focused on health. We're funded by individual giving. So individual giving is 92%. And I know in the prior sessions, a lot of business models were discussed. This really is kind of the consumers putting the dollars where they are getting value. So we don't have big foundations funding us. Individuals, the millions of people that use CaringBridge, are funding CaringBridge. It simply started as a website. You go to CaringBridge.org, very easily create your website for a patient. A caregiver usually creates it to help that patient, that caregiver, that family stay connected to their family and friends. It's not a connect to other people like you. It's really your support network that's being provided. And it started in 1997. Who here remembers 1997 around technology where internet was maybe in 25% of the houses and you had to use the modem? Ooh. Okay, it wasn't that dark in 1997. But had to use the modem or you didn't have this wonderful connectiveness of wireless. A good friend of mine had a very premature baby and asked me to make those telephone calls. I'm a technologist at heart, been very passionate about technology my entire career, and turned to the internet. I said, you know what, I'm going to create a website. So created a website for their baby, Bridget, and it instantly eased that burden of telling people what was going on. But the wow event was the amount of love and support that they could garner through technology. Cold, hard, evil technology that will rip society apart turned into a compassionate, loving support system. Never have looked back since then. Every day, fast forward to 2012, every day over 500,000 people actually get a notification of a CaringBridge site that's been updated. About every 4 to 5 minutes, a new CaringBridge site is created. We're everywhere. I mentioned, Grant yesterday was talking about mobile. Mobile has exploded with CaringBridge. We have apps on Droid and iPhone. We have a mobile website. And that use has exploded. Everyone has these devices in their hands. It becomes very personal. You connect more. I know a lot of you have Fitbits on, but every one of you probably has a smartphone and you have connected to a loved one probably more than you've looked at your Fitbit. The idea of sending a tweet, posting something on Facebook, sending an email, connecting to your loved ones is part of your everyday life and even more important when you're going through some type of health journey. We've had significant reach. Again, we're very focused on health. In the last 12 months, over 45 million people have connected, individuals have connected on CaringBridge. And I think at the heart of it, 91% of people that have used CaringBridge, the patient, the caregiver, those family and friends around them, have talked about how CaringBridge has made their health journey easier. And this applies also to aging. We have seen a significant growth of people that are older using CaringBridge. And I think what's interesting about devices and everything, and we've talked about how can we make people responsible for their health, it's the loved ones in your life that make you more responsible for your health. Mom, did you take your pills? You're looking a little pale today. Did you take a walk? It's the support community that's going to help the aging community stay in their home. In CaringBridge, we've seen a huge increase of the age difference of people using CaringBridge. That's a quick introduction.
Thank you. So how many active accounts do you have now on CaringBridge?
About 300,000 CaringBridge sites are active today. And again, that sends out these notifications to people that have subscribed when someone is updating their site. It's still very basic around social networking. We know that the time is right to explode that, to include other network of services we talk about. So I think being able to use this underlying, very trusted social network to plug in other services, maybe devices, things like that, is something that we are very actively looking at and trying to promote within these communities.
And besides word of mouth, how do people now learn about CaringBridge?
We have a lot of great partnerships and outreach partnerships with hospitals, with clinicians, with faith-based organization, people, even health, insurance companies where the caseworker will recommend CaringBridge. It's a free service, it's a nonprofit, it's there in the public domain. Anyone can use it for any type of condition, be it premature birth all the way to helping your mom age in the home. So it is very widely used, and we do a lot of outreach with these health communities to help promote CaringBridge.
So some hospitals may then recommend to their patients or their
Absolutely.
loved
We have
ones.
about 950 relationships with hospitals where they're actively promoting CaringBridge as part of their, family-centered care.
And are you doing that with insurance companies as well?
Yeah, we work with the caseworkers. For example, Blue Cross Blue Shield, Health Partners. We're based in Minnesota, but really have a worldwide reach.
Uh-huh. So how is this then different from, say, somebody just creating a site on Blogspot?
It's not that much different, except we have the whole infrastructure. We're very proud, again, being a technologist, we've been built on a very strong foundation. So we have the privacy and the security and the business continuity plan to make sure this never goes down. For example, in the last 12 months, we were down 4 minutes in the last 12 months. So it's very proud that we were able to do that. We also help provide customer care.
And to notify people that you've updated your site, do you enter a list of recipients and it automatically gets sent? Is that
It does. That happens via word of mouth. Our sites are actually blocked from search engines, so you can't search for, if you had a site, Eric, I couldn't search for your site, but I would have to know what your URL is, your site name is. You could set the privacy levels on different levels where it might be more open, or you might have to approve that I can see your site.
Great, thank you. Dr. Vincent Grasso is a well-known surgeon in New Jersey and is the Health Information Technology Senior Advisor for the Office of the Chief Technology Officer at Panasonic, which I presume means that Panasonic's interested in healthcare, and you are the person leading that effort. What are you looking at with regard to your relationship there and to this whole issue about aging and making it easier for people?
It's an interesting, as a laparoscopic surgeon and software architect, I kind of have the ability of looking at clinical things and technical things, and have watched for the past 15 years or so technology be injected into the healthcare delivery process. Some of it very interesting, some of it providing a lot of interesting new capabilities. But what we've learned as we've gone from an analog-based delivery model to a digital one, and what we're talking about up here is if we're going to be providing healthcare to the aging population, to others that are at home in senior assisted living facilities and nursing homes, that process is a distributed business process that requires a lot of the solutions that we're here talking about. What I have found particularly interesting about Panasonic and what my capabilities and the subject matter experts that we have that are involved is, as we go from an analog to a digital-based delivery model that's decentralized, you have to drag a lot of things to the home, to the nursing home, to patients, to where they work. You have to bring digital devices that capture objective and subjective information, heart rate, monitor, speech. You have to display information. You need display devices. You need to be able to communicate in a synchronous and asynchronous manner. And medicine is a very interesting business. We communicate in an asynchronous manner. We leave messages for our stakeholders and counterparts. We don't really communicate in many instances in real time. So how do you handle all the messaging and the communications? How do you handle security and audits as you start moving into a distributed digital process? So as we try to move from an analog centralized model to a decentralized model, you need the wherewithal of an infrastructure to support that. You have a very interesting site that's had a lot of uptime. It's done well. There's a lot of infrastructure to do that. It doesn't happen easily. Unfortunately, there's a lot of entities that do not possess the excellence to support those kinds of business processes. And as we all in the cloud try to mingle and integrate, it becomes very difficult. So I think what we all see at these sessions are amazing opportunities. There's a screaming demand for much of these services. but how does one go about do it in a secure manner that's affordable, that provides the physicians with the tools that are easy to use? You know, there's still a lot of work that needs to be done, and I think that's part of our challenge. And what I like about Dr. Mayo, if we look at my one little slide, is why is the Mayo Clinic so successful? I mean, the Mayo Clinic was successful because they were very capable physicians, but also because they were the first entity that stitched together a community of caregivers that allowed a decrease in communication managing a patient. That's why there are 55,000 folks operating within the Mayo Clinic, is their ability to understand how to work together and communicate in efficient means and manners. So as we start doing all the things we're talking about, it requires cooperation, integration, lots of stakeholders, and this is the exciting part of this whole process.
Mm-hmm. Okay. And I presume we're all taking a look at that. Have all of you who are involved in marketing these new products yet done research on how this is going to help, or whether it is actually helping people stay in their homes, or is it too early to know about that and live better lives as they age?
I think, you know, from a personal emergency response system perspective, I think it's pretty clear that, I mean, this technology has been around for 30 years. Mobile version of that is the evolution of it now, you know, coming into the marketplace. But clearly it's helped people stay in homes longer. I think that when you introduce mobile into this equation, it gives those folks that are still, you know, going out of their home that added independence and feeling of security. And obviously for the caregiver, and I think the caregiver, typically the family member caregiver, is an incredibly important stakeholder here. You know, advanced systems will give caregivers insight into, you know, where their loved one is and how they're moving around, and are they active and are they inactive, but all with the goal of trying to help them stay in the home longer and provide added independence and peace of mind.
Is anyone concerned that there might be information overload, that all of this is just too much for the average consumer? Please.
Yeah, one of the problems that we've encountered over the past decade of measuring patients' biological information, the physiological data from the home is, I'm not aware of a physician that's very excited to have a 24-hour feed of vital signs out of your home, because there's enormous liability in being provided with an abnormal blood pressure and not acting on it. You know, any one of us can bend over and pick up an apple that fell on the floor, and if you happen to have a real-time blood pressure check at that moment, you may be hypertensive. So now what do I do? So what has happened is there's enormous data bloom and overload, and it requires expert systems to inject themselves to mitigate the risk of, when the blood pressure was high, is it an aberration or is it a valid event that needs to be followed up? So as soon as you start playing, let's collect all the data, you then by definition have to have analytical tools to start looking through all that stuff. Otherwise, I'm not aware of really a system that can handle thousands of feeds coming in over the manifold of a healthcare system. And you alluded before to the expert system of the front door open, the blood pressure is high, and I don't hear anything on some audio check. Maybe you fell down. I mean, but they're all maybes until they're validated. So this is a battle space that we're wrestling with.
You know, AARP and others have done a lot of studies in terms of the how. I think when we started Independa, we worked with IDEO, the design firm, to answer that question. What does it take to really succeed? Because the key in I think all of our worlds is, in terms of aging in place, everyone wants to age in place. So it's something like 93% viscerally want to stay independent. So how do you tap into that emotion with technology? And the two missing elements that we found were the integration and also simplicity. So that's, to us, the answer is it has to be fully integrated. So that as a caregiver, you don't have 5 different vendor relationships. If your son has diabetes, you have a glucometer and you're done. Even if it's cellular to the cloud, you can set thresholds. But if your mom has diabetes, it's not just that. She may have hypertension. She may start getting, you know, forgetting to take her pills. She may be socially isolated. And you really want to have a system that addresses all of that holistically. So the how for us translated into how we developed Independa.
Please, Sona.
Just to add on that, I think with CaringBridge, again, it's not the device thing, it is the social aspect. But one We haven't asked a specific question, did this help you age in the home, but it has definitely made their lives fuller, and it has helped them, you know, in their health journey. But other aspects we have, even with CaringBridge, which is a social thing, the primary author or caregiver of the site, that can be shared. We have a co-author capability, which some of the blogs do not. And that sharing of responsibility, I think, is going to happen with these devices as well. It's not one person that has the burden of trying to monitor everything. So I think that community, that shared burden, is something that will continue to help people age in the home.
Mm-hmm. And Dr. Grasso, what you were saying earlier about this filtering that's necessary, it seems to me to be analogous to the whole debate now about the efficacy of PSA testing and whether you're getting too much information that you really shouldn't have. Are these filtering technologies developing now? Do they exist, or how are we dealing with this?
The filtering and analytical process is a double-edged sword. When you have one variable to assess, it's rather simple. But what do you do with the 65-year-old smoker diabetic with a PSA level that's high? And all of these commingling of biological and physiological events skew what you had thought the simple filter would suffice. So one of the complexities of this whole discussion is, as we're aging, we're not aging linearly with one simple disease process. So the CHF, COPD patient that fell and sprained an ankle has a whole different presentation to an analytical tool or a filter. But you must filter and you must analyze. So there's the opportunity again of how do you stitch all these things together to find that solution to meet the 80%.
We'd like to take some questions, and I presume there's a floating mic around if anyone has a question. Oh, it's right up there. Okay. Not yet? Well, I have a question. I know that last year there was an area in the North Hall to show all these fledgling nascent technologies and startups and about-to-bes. And this year we seem to have a lot of the same. So what does that tell us? Is this a nascent technology that's going to remain nascent? Or is it just taking longer to develop? Or is this a normal life cycle and we're just in the middle of it and we can't see, we have no perspective on it?
Well, maybe I'll go first on that. To us, the technology is irrelevant, and what we call it, whether it's mHealth, wireless health, mobile health, telecare, telehealth, remote patient monitoring, there's a lot of different conferences, different labels on it. In the end, I think it needs to go into where the solutions are being addressed. So an FDA-approved maybe solution for doctors, for clinics, as well as a solution that uses similar technologies in assisted living, senior care. I think that's where, for us anyway, that's where the pain is being addressed. And so it's not about the technology, it's about the solution and going to the people on the front lines managing the elderly, whether, again, home care, home health, insurance companies. Mm-hmm. So I think it'll just grow, but it'll grow in different areas as well.
Mm-hmm. But you're satisfied with the speed at which it's growing?
In our case, we're not waiting for CMS codes. I think that's part of the challenge with our sick care system is getting paid. But fortunately, in independent living is one area where people are spending $450 billion a year out of pocket versus $150 billion for insurance companies. So really, when you think about it, if we did everything right, there shouldn't be a need for out-of-pocket pay for our solutions, but people are paying. So we're going after that market, not necessarily for CMS codes to catch up. I think they will ultimately. Okay.
And Rich, I noticed you smiled.
Yeah, I mean, I would say it's certainly an evolving industry. What's interesting is, of course, there are startups involved and continuing to get involved. But what you also see now is you see some larger companies getting into this. Qualcomm was certainly an early entrant in mobile health. I mean, I was there for 6 years before I went to LifeComm, and we stood up a wireless health and life sciences team in 2004 when it was pioneering days of mobile health or telehealth. The other interesting thing is you see the government getting involved. So if you look at the National Institute of Health, they put on the mHealth Summit down in Washington, D.C. 3 years ago, there were 1,000 people there. 2 years ago, there were 2,500 people there. And this year, there were 3,500 people there. And it's global. There are people coming from all over the world. And if you look at various types of mobile health and wireless health solutions out there, it's a global phenomenon. Healthcare is typically a pretty slow-moving giant, so you can't expect that just because you introduce some technology, it's going to make it move fast. So I don't think anybody's probably satisfied with the speed of evolution, but it is what it is, and just keep innovating, and it'll happen.
Great. Well, we have a first question. Please state what it is.
Thank you. Karen Klein, CEO of Silver Planet. I have a question for Kian, but I also have to say to Sonia, who I've never met in person, that your CaringBridge, for people who don't know about it here, for my friend who died, gave peace to her family, and it's an amazing site.
Thank you.
Kian, you said you have 2 different devices, and so could you explain to us how for a senior who I deal with, medically challenged seniors who aren't particularly literate on a computer, how they can use your device?
Sure. I don't know if that slide could ever come up on my end. That would be probably easiest to show you. But there's actually 3 different devices. The simplest and first one is a phone. So if you just go down while I'm talking. So the phone is the most important device for us, and that's the primary foundation technology, where you get medication reminders, you get social connectivity, you get birthdays and anniversary, auto connection to your friends and family. You get health measures, so you can actually input your health data using a standard phone. Someone from home health could do that for you. So that's, let me make sure I don't hit the doctor here. So, so that's the first one. The second one, Angela, is software that runs on multiple devices, and that's for social engagement. That's optional. So if a senior is already, to Eric's point, if they're using maybe an iPad and they have a computer, they're great with that. You don't need our device per se, although the reminders get integrated in that. And then last but not least is Artemis, which is the goddess of protection, particularly for the vulnerable. So we give you health and safety with this last device. And again, that's not our device. We integrate with multiple devices, but that gives you in single form the ability to passively step on a scale, for instance, and have that data be transmitted. Or if you open the door, that we capture all that in one place. Did that answer your question?
Sure.
Okay, thank you.
Thanks. Next, please.
Hi, I'm Rachel Tubman. I'm CEO of Musical Health Technologies. And I was wondering from Sonia, you were talking about different types of partnerships and plugins and things that you wanted with your mobile, and I was wondering where you guys are going, what sort of services you're interested in offering.
The first one we're doing actually just in a few weeks, we completed a beta, was the idea of a calendar. It's pretty straightforward. We call it the support planner. Having a more integrated planning. People have been doing that with CaringBridge for a number of years. That's one direct one. We also do things like, we already have where there's a caring book to help people have a remembrance of their journey, be it a newborn baby that enters kindergarten to an end-of-life situation. So those are just a couple of things, but the sky's the limit. We're on the cusp of an explosion. This technology is here, and these mobile devices that people have been using for everyday activities will do more and more and more.
Thanks.
Gregory Vader from GracefulAge.tv. You know, over the last 2 days, 3 days, I've heard everybody moving up to the cloud. It's a little unsettling because I think the older generation, when they think of cloud, equates that with heaven, and I'm not sure that they want things to go to the cloud.
Better than the other way.
I'm a little unsettled on that. But the question is kind of the integration of all this great technology we've been talking about. Who decides whether the family or the caregiver is competent to use the technology? And then who decides if they continue to be competent to use it? Because what I see is, I represent on the legal side the assisted living industry. I see that families, once technology or a caregiver comes in the home, they back off and they think, all is good, I solved my problem. With some of this technology we've been talking about, I think as soon as you lay out the money and you got it all wired in and it's plugged in and it works the first time, I back off and I'm gone from the problem, except maybe on a weekly or a monthly basis. So I guess it raises a larger question of, do we need to develop an ethical standard for the technology industry? Does that have to be married to the medical side? Does that have to be married with the insurance side? Because who's going to decide these questions of what goes into the home and how long it stays there to serve all of us as we age.
Would you like to take that?
That's a very good question, and why we need to maintain the moral high ground of the patient comes first. The patient comes first, not the patient's family comes first. If the patient comes first, then we are all subordinate to that need. And as we construct these solutions, we do justice to the patient by doing what's best for them, but we need to accommodate family and everyone else that's involved, the stakeholders in their care. That's a very fine line between how do I do what's best for the patient, but I may have to do lots of other things for these other stakeholders that may in fact be a gray zone of what was ethically correct for the patient, especially when a patient can't speak for themselves, they have a proxy. So as we digitize, these are all evolving new problems that we haven't yet solved clearly, but there's a need to identify this as we're integrating. And I don't think anyone really has the moral and ethically correct solution yet for that. But so long as the patient come first is our mantra, we should arrive at what's best for them. And maybe that would dictate a lot of how we integrate and build our solutions.
And just to add to that, in our case, again, it's not even a patient, it's a person and a consumer. And I think the problem's been solved. We don't need to solve the problem. You've solved it in assisted living. Home care has solved it in their industry. Home health has solved it. And back to my earlier point, it's not about the technology. It's about enabling the technology within the existing models. And so just like if you might hire someone to come in and take care of mom, you shouldn't maybe remove yourself entirely of that situation. The same would apply with technology. It's not a new problem. It's just a different way of addressing it.
While I would agree that the patient certainly comes first, I think that any kind of solution like this that doesn't include some kind of component to enable the family caregiver is lacking, right?
Yeah.
Sometimes patients, and I agree with, in our world it's really not a patient, it is an individual. Sometimes they don't know what's best for themselves, right? Or they get to a point in life where they don't know what's best for themselves. So they do need family support. And I would say the opposite. We're about engaging that family caregiver and making sure that they are involved and giving them tools to be more involved and give them more insight. Because a lot of times, children are living hundreds of miles or thousands of miles away from their parents. Their parents get to that point where they become fragile, and that child is troubled. They feel guilty, and they want to be engaged. They need tools to get engaged, and I think it's the responsibility of any solution provider to enable that, because that's going to be what's best for the patient ultimately.
And I just want to concur with that. I think the family at the center of it, or not even the family, the community of support, it could be a neighbor, is vital for these types of things. And so I think it's interesting to think of it as an ethical type of question. But definitely, the more people that are involved in that care and helping with those decisions, the better.
And I think we're in an interesting period, because it's ironic that we're looking to apply advanced technology for the age group least likely to be able to use it. Right. Whether you're talking about the patient or the adult parent who is probably in their 50s and 60s, and I constantly get questions from people in their 50s and 60s who are completely baffled by technology. I think today's young generation kids are the first generation growing up with computers. When 3-year-olds know how to use an iPhone almost inherently, it's a different world. So a lot of this is just a time-based problem. So that presumably means you really have to spend a lot of time making sure that your devices are extremely well designed and easy to use.
Just a plug for the Wii and Apple. Mm-hmm. 5 years ago, maybe 7 or 8 years ago, there was no example of technology being used by the elderly. But the Wii came, and everybody's playing, bowling in senior living facilities, right. And they're not playing a video game; they're actually bowling and socializing. And the same thing now with the iPad. So it's not the technology; it's how we design it.
Yeah, and I've seen that in my own life as well, with family members who are in their 80s who had a theoretical interest in a computer and could never fathom how to use it. And as soon as we gave them an iPad, their world had changed.
I think just moving from buttons to actually touching, and that technology in itself, I think, is changing everything. It's more intuitive to just be able to touch and do this or on here. And so I see my mother, who's aging, really just where before she would have to call me every day about how do I run this computer and talk to the mouse, where she is able to, to actually move things around.
And with regard to your website, have you gotten any pushback from the elderly not knowing how to use things and find things?
Not so much pushback. We've had a lot of people that elderly that have come to CaringBridge to visit perhaps their granddaughter, where it's the first time, we've gotten calls of it, this is the first time I've used the internet. This is the first time I've used this computer. A great quote from an uncle in Switzerland about 5 years ago was, finally a good use for the computer. So I think, you know, these things that are engaging people will bring the elderly, and you know, I turned 50 this year, so I got my ARP card in the mail. I think there's a bum rap on, people tend to overgeneralize that, and I think as things become more intuitive and easy to use, things will become more and more available.
Yeah, okay. Dr. Grasso, any comments on that?
You know, what I'm seeing over the past 2 years, when I was during my surgical practice, I started seeing patients come in with a stack of papers that they downloaded from the internet about some disease process. And you know, I hear this all the time. You can walk in with 30, 40, 50 pages of articles about some disease you have, and there's not a physician in the world that can keep up with every disease that they may see. So there's a disconnect in some way and a need. What I'm also seeing is patients that have, say, colon cancer, they're diagnosed with colon cancer, they have a colonoscopy. The family member that took them for the test is able to communicate with the whole family network instantly and disseminate all that information out. And the specialist didn't even get the result yet. So we're communicating on the outside very efficiently, and then the physicians that are involved in this care are still in a very slow motion mode. And how do we put the two together? Because the family and friends and that whole network receives updates and things quickly, and the physicians taking care of a patient don't communicate as quickly. And so there's an imbalance there of the ability to communicate, but on the medical side, we can't communicate that openly for HIPAA and other reasons. So it's easy to communicate on the outside. There's less regulations. How do you dovetail the two together?
But then, of course, you're often in a situation of too much information.
Right.
Yeah. And people think they know the answers and probably start dictating to the doctors what the course of action should be.
Sure.
Yeah. Okay. Any other questions? Well, I think that will wrap it up then. Thank you all very much. Thank you for your participation.
Derek?
Thank you. Thank you.
Appreciate it.